Hi friends, I'm back again. This is continuation of our topic on kidney failure. So today I'll be discussing on types of kidney failure. The four we have major two types of kidney failure, and under these major two types we have five subtypes. For the two type we have acute kidney failure, then we'll have chronic kidney failure. On this acute kidney failure, the acute is made up of two, and the chronic is made up of three. The acute kidney failure, one of it is acute urinary kidney failure. And what is acute urinary kidney failure? This is when there is no sufficient blood flow to your kidney. Here, the kidney filters toxin from the blood without enough blood flow. When the kidney is trying to filter toxin out from your body, the kidney does not have sufficient blood to filter those blood toxins. That's when the person will have acute renal kidney failure. But this type can be treated through discovering the this type, yes, through discovering the factor that has led to the insufficient blood that will help the kidney to pass toxins. If you have a disease, if you have maybe for women, if you are bleeding or for whatever reason that has caused your blood not to be sufficient for the supply of this blood to the kidney for it to filter out toxins, if this cause is known and treated, the kidney failure will cease to exist. So this type of kidney failure, that's acute renal kidney failure, is mild. It can be managed and it will not extend to kidney failure. Rather, it will be mild. It will not extend to total kidney failure. Let me use that word, total kidney failure, because it's a type of kidney failure, but when it's properly managed, it can cease to expand to the total failure of your kidney. So the second one is acute intrinsic kidney failure. This type of kidney failure is a kidney failure happens when there is a direct trauma to your kidney. For instance, if there is an accident that you got involved in and the accident affects your kidney directly, or if there is any physical activity that has directly touched your kidney in a negative way, it can affect your kidney and it can lead to kidney failure. But if managed properly, it will not extend to total failure of the kidney. There are other factors too that can cause kidney intrinsic failure, which is the second type of kidney failure, and that is shock. You have to, we human have to learn how to manage shock. There are some news that are not palatable. When they come, how do you react to it? How do you react to it? If you know that something has happened and your reaction will not change such situation. So you that is still alive, for instance, God forbid, you hear of a news of one's death, maybe your beloved person's death. How will you react to it? It's important to manage yourself so that you don't do things that will affect your system, that will affect your kidney. So you have to manage shock. Whatever news you hear, I pray we'll be hearing good news. But whatever comes your way, know how to manage it so that you don't stress your kidney. You don't do whatever that will not help your kidney. So when there is toxin overload to your kidney, it can also affect your kidney, and that will lead to acute intrinsic kidney failure if you have a toxic overload. Bleeding too can also affect the kidney and it will lead to acute intrinsic kidney failure. That's for the second part. Then the third part is chronic renal kidney failure. This comes when there is an extended period of lack of blood flow to your kidney to help the kidney function properly. It now makes the kidney to shrink, and when the kidney is shrinking, it will now lead to malfunction of the kidney, which can cause kidney failure. But this type is also mild if curtailed properly. It can cease to lead to kidney failure. Then the fourth one is chronic intrinsic kidney failure. This type happen when there is long time damage to the kidney due to intrinsic kidney cause. kidney disease. Intrinsic kidney disease develop from direct trauma to the kidney, such as bleeding or lack of oxygen. When your kidney is not having a sufficient oxygen, or is not having a sufficient flow of blood, it can also lead to kidney failure. And bleeding too can also lead to kidney failure, because it's blood that the kidney uses to remove toxins from the kidney. So if there is not enough blood flow, let's take for instance the people that make pap. You have a pap you want to filter, and the pap is very thick. There is no way it can pass through that filtering. But if the pap, you have water in it, the water will help the pap to filter whatever you want to filter, so that you get your final outcome. So if there is not enough blood supplied to your kidney to filter toxins out, it will make the kidney to shrink, and that will lead to kidney disease, known as chronic intrinsic kidney disease. And the last one, chronic post-renal kidney failure. This happens when there is a very long time blockage of the urinary tract, which prevent urination. This cause happens when you are not able to pass urine. It will now block it will now block the urinary tract, and when it does that, it will not help if when it does that, we said that the kidney filters toxins out from the blood, and it will not pass it to the bladder, and the bladder will not pass it to through urination. So when your kidney is not so when your urinary tract is blocked, that means the kidney, when it filters toxin out to the bladder, there will be no urination. And when there is no urination, that's the urinary tract is blocked. It will not go back to the kidney, and it will not make your kidney to perform properly. That means whatever that is blocked is now there is blocking the kidney, and there is no way this blockage is passing. There is no way the blockage is allowing passage of toxins to be eliminated through urination. So this is what causes chronic post-renal kidney failure. That's for that. So the next topic we'll be looking at is symptoms of kidney failure. How do we know if, God forbid, I don't pray for that, but these are realities. Every day we hear of people's kidney failing them, loved ones, friends, celebrities, some of them, most of them. There was this man I saw on internet a few days ago, a very handsome actor. I can't remember his name, Chimezi or something. And I was reading what led to his death, and they say it was kidney failure. There are a lot of factors that can lead to kidney failure. So if symptoms of kidney failure are detected on time, it can be managed properly, and the person will live longer than when it's not detected. So as I sorry, if it's not detected on time, it might not be managed. But if it's detected, it will be managed. So how do we know if we have a kidney disease that leads to kidney failure? It's kidney disease. When your kidney is infected, that's when gradually it will now progress to enter kidney failure. So, but if there is any kidney disease and is detected on time, it will not lead to kidney failure. So what are the symptoms to know if there is kidney failure or not? One of the symptoms is a reduced amount of urine. On normal basis, if you know the amount of urine you pass out, and at some time it now reduces, and the reduction progresses, and you see that the amount of urine you pass is not the way it is, then you will just have to go to test and check if there's anything wrong with your system. And then if you have swelling of your legs, your ankles, your feet, and then other parts of your body, that means there is retention of fluids caused by the failure of the kidney to eliminate water waste. So these are the symptoms. Another symptom is unexplained shortness of breath. Unexplained, you just can't explain why you have shortage of breath. It can be a sign of kidney disease, so you have to go to hospital for check up. Then if you're always confused on issues on normal day, you are supposed to contribute. On issues on normal, you're supposed to articulate and prefer solution to whatever issue is. You are just confused, and it continues. You have to go for check. If you also experience pain or pressure in your chest, you have to go for test. If you also experience persistent nausea, you have to go for test. So these are some of the symptoms of kidney disease that progresses to kidney failure. But then the National Health Disease Control saying that 90% of women do not even know when they have kidney disease. So that's why it is necessary to go for checkup to detect if there is any problem of such, so that it will not lead to kidney failure. So coma too can also be a symptom. When someone enters coma, it can also be a symptom of a kidney failure. Then foamy urine with excess bubbles is also a sign that you might have protein in your urine, and that protein in your urine is a sign of kidney disease, which if not treated can lead to kidney failure. That is for that. On my other episode, I don't want to make this video too long. On another episode, I'll be talking on causes of kidney failure. Thank you. Bye for now.